video series at Teeth Neurology. Let's discuss about dizziness. I Dizziness, when a patient says they're dizzy, I always ask them, what do you mean by dizziness? Because sometimes people use the word dizziness to mean balance issues. And people can assume it's vertigo when it's really not. They're using the word dizziness, but they actually mean balance issues or ataxia. Or sometimes they can mean lightheadedness. So you have to always ask, what do you mean by dizziness? But if it's vertigo or vertigo, that's what we're going to discuss today, the differential diagnosis of vertigo or vertigo. Probably the most common reason is what we call as benign positional vertigo, or BPPV, and that comes from the inner ear, crystals in the inner ear. So when it usually happens, it can happen from trauma, it can happen spontaneously though, it can happen as a sequela to inflammation in the ear from acute vestibular neuronitis. And what happens is when the patient moves their head in a certain direction, like for example, bending down, looking up, rolling over in bed, even in a moving car, they get dizzy for a few seconds because the crystal moves in the ear, and the crystal moves, they get dizzy. It just lasts a few seconds, but it can keep happening throughout the day, and it's very uncomfortable. The meclizine does not really help with that condition. I mean, some patients say meclizine helps, but it's temporary. The real treatment, which is very effective, is the vestibular rehabilitation. You can do the Pons-Epley maneuver, and it's diagnosed using the Dix-Hallpike maneuver typically. Another cause of vertigo would be vestibular migraine, a lot more common than it's diagnosed. Vestibular migraine is migraine presenting as the dizziness of vertigo. It lasts longer, it's a lot longer than benign positional vertigo, meaning the time duration. It presents more like a migraine, it should be treated like a migraine. You might not even have headache with it. Then you can have what we call as acute labyrinthitis, acute vestibular neuronitis. Patients with that get violent vertigo associated with nausea and vomiting. And you can see their eyes moving often, which is called nystagmus, and they often admit to the hospital. Most of those patients recover without any sequela, but about 5% of patients go on to develop BPPV. And then you can have other rarer causes of vertigo, like Meniere's disease. Meniere's disease is where you get progressive dizziness and associated with ringing in the ears and deafness. And that's because of increased fluid in the inner ear or endolymphatic hydrops. You can also get rarer causes of dizziness where you get lesions in the internal auditory canal. Sometimes brainstem strokes can cause vertigo, but they're often associated with other symptoms like double vision, slurred speech, numbness. The neurologist should be able to make a differential diagnosis of what's causing the dizziness of vertigo based on the symptoms and investigations.